Tonight, a new option for opioid addicts tied to an old treatment drug. Methadone isn't new, but a bill is helping remove barriers doctors and nurses face, giving it to people addicted to opioids. Reporter Mary Klingler spoke to a local pharmacist about why they say this marks an important step, getting people in need more help.
At the end of last year, President Joe Biden signed a bill eliminating the data waiver program.
It was designed to provide training for medical providers on addiction medicine and the prescribing of medications used to treat addiction.
Now, every doctor with a DEA license will be required to get that training. Metro Drug Coalition Executive Director Karen Pershing says this will allow more providers to prescribe addiction medication.
The X waiver process for some has been a deterrent to prescribe the medications.
He says this will open up the ability to prescribe addiction treatments, whereas before, patients typically had to go to a methadone clinic to get a prescription for buprenorphine.
The medications are very safe.
And South College pharmacy professor Dr. Tyler Doherty says now these treatments will be more accessible to those who need them.
Access to providers can be very challenging, especially in very rural environments, which Tennessee has many of those areas.
And it will save lives. According to the CDC, more than 100,000 people in the United States died from overdose last year. Doherty hopes it will slow the number of people using and addicted to illegal drugs.
Maybe we have less people utilizing substances that are illicit and more dangerous.
Reporting in Knoxville, I'm Mary Klingler.
Starting in June, any doctor going to the DEA to renew their license required to prescribe a controlled substance must also take that 8-hour addiction training course. Remember, if you or someone you know is struggling, there is help available right now. You can call the Tennessee Red Line. That number is 1-800-889-9789.